At least 1,000 nurses and midwives have been exposed to the coronavirus disease in Nigeria. 70 of them have so far tested positive, and at least 6 have died. The Nurses and Midwives Association is now seeking better working conditions as frontline health workers in the fight against the disease. It made this known in Abuja at the end of commemorating the Nurses Week there. Lara Afolayan reports.
The Nigerian Nurses Week for year 2020 has just ended, and these nurses and midwives see this as the right time to make known their occupational frustrations to government. They are particularly concerned about the number of members already infected or have died from the coronavirus disease while in the line of duty. The World Health Organization standards allow for 14 nurses per 100,000 patients, but in Nigeria's case, it is 5 to 6 nurses to that population. More worrisome is inadequate knowledge on COVID-19, as well as the use of personal protective equipment by the healthcare providers. This largely explains why the infectious diseases principle and protocols are sometimes violated, thereby unduly exposing them to infections. Poor working conditions have not also helped matters.
The government and the PTF need to be sincere. For today, it is difficult for the federal government of Nigeria to showcase the statistics of people who are actually working on ground. You are a living witness when a highly placed government official in this country was at the House of Rep and he was being asked, and the person cannot confirm or justify the issue of payment of hazard allowance.
These healthcare professionals are now seeking an improvement in working standards. They as well want life insurance policies, payment of salary arrears, capacity building, as well as improved synergy between relevant stakeholders on finding a lasting solution to the coronavirus disease.
The Federal Ministry of Health to release without further delay the withheld salary of our members, especially in the federal health institution, to formulate policies that will reduce disharmony within healthcare professionals by ensuring justice, equity, and fair play in the health sector. Provision of the modern equipment infrastructure and adopt modern ICT in health sector to improve Nigeria health sector performances and learn from the lesson of COVID-19 that nowhere is better than our home indigenous healthcare system.
The nurses and midwives are worried that the healthcare system has been overstretched and on the verge of being overwhelmed. They now want more investments committed to that sector for a needed upgrade and facelift at the moment. The nurses and midwives are hopeful that their demands are given urgent attention by the authorities for the benefit of the healthcare system, as well as in controlling the spread of the coronavirus disease. Lara Afolayan, TVC News, Abuja.